videos. Today we discuss about how common is insomnia. Both acute and chronic form of insomnia are very common. Roughly 1 in 3 adults worldwide insomnia symptom, and 10% of adults meet in criteria of insomnia disorder. Sleep disorder habitat need can be very different for person to person because these variation experts consider a wide range of sleep characteristics. Some example of this includes early bed, early rise. Some people naturally prefer to go to bed, wake up early. Night owls, late risers. Some people prefer to go to bed and wake up late. Short sleeper. Some people naturally need less sleep than others. Research indicates that there may even be genetic reason for that learn sleep different. Some people develop sleep habitats for specific reasons such as their profession. Military personnel of combat preference experience often learn to be light sleeper because of demand. A danger of other profession on the opposite and the spectrum. Some people learn to be very heavy sleeper, so they can still sleep despite surrounding noises. Natural changes in sleep needs. You need of sleep change throughout your life. Infants need significantly more sleep between 14 to 17 hours per day, while adults age 18 and as a need about 7 to 9 hours per day. Time experts classify insomnia as acute to chronic. The chronic form is known as insomnia disorder. Causes primary insomnia means it happens on its own. Secondary insomnia means its symptoms when other conditions circumstance. Insomnia has several potential which falls into a few categories. With have trouble sleeping daytime effect. Chronic insomnia characteristics. When you trouble sleeping is important symptom of insomnia. There are three main ways this happens. People commonly shift between them over time. This means you have trouble falling asleep. Middle insomnia, this form make you wake up in middle of the night, but you back sleep. It is the most common form factor of lost two-thirds people with insomnia. Late early waking insomnia. The form means you wake up too early in morning. Daytime fact because you need to sleep to be your best disruption like insomnia common cause symptoms that affect you while awake. This include feel tired, unwell and sleepy. Delayed response such as reacting too slow while you driving. Trouble remembering things, slow thought process, confusion or trouble concentrating. Mood disruption, especially anxiety, depression and irritability. Other depression in your work, social activities, hobbies, and other routine activities. Chronic insomnia characteristics is also important. If you have symptoms have certain characteristics, you may have chronic insomnia. These characteristics include circumstance of chronic insomnia. Diagnosis requires insomnia without circumstance that would interfere with your ability to sleep, such as change work schedule. Diagnosed insomnia requires having a sleep difficulty desire, having time and right environment to do so. Frequency chronic insomnia require you to have some frequent, at least 3 times per week. Chronic insomnia lasts of 3 least months. Explanation: the insomnia is not having because the substance or medicine include both medical and non-medical drug. Another sleep disorder, other medical and mental health condition also cannot fully explain why you are not sleeping. Expert does not fully know the why insomnia happens, but the current understand is that this condition can involve many factors. Some of these factors could be cause or they could sleepy contribute. More research is necessary to understand exact how of why insomnia happens. Family history, brain effect difference. Sleep traits and conditions including insomnia seem to run in families. People with insomnia may have more active brain or brain chemistry difference that affect the ability to sleep. These include temporary illness like minor infection or injuries, chronic conditions like acid, mental health conditions About half of chronic insomnia also have at least one other mental health